The major challenge for patients in the actual landscape of treatment of breast cancer is access to innovation. In the last 10 years, we had a revolution in the cancer treatment approach. Specifically, we had precision oncology and secondly immunotherapy. So it's quite important for a comprehensive cancer center like the European Institute of Oncology to guarantee to the patients access to innovation. What we did specifically is to create a division of early drug development in order to reduce the gap between proof of concept that the drug is potentially active and access to care. Just to give to you an example, the time between the first demonstration of activity of a specific agent and the access to care for a specific patient is between 3 and 7 years. So, 3 years in the United States, 7 years in Europe. There is a huge gap between demonstration of activity and opportunity for the patient to have a benefit from that specific agent. If you have a division of early drug development, you will have the opportunity to test this agent in the early development and to guarantee access to care to our patients. And that's what we did in the last 10 years. It's quite important at this point because any institution working on early drug development have a privileged access to specific agents that are not on the market. And usually in the era of precision oncology and immunotherapy, these agents are quite effective. I have specific patients under treatment since 4 years with agents that 4 years ago were experimental and actually are standard of care. That's why European Institute of Oncology now is improving more and more the access to innovation from surgery to interventional radiology to diagnostic and to care. I really believe that in the future drug development will change dramatically because now you have many agents in which the attrition rate is very low, since you have agents designed on a specific target that are quite effective. So what we can offer to the patient is a nearly access to a lot of agents that are really active and that can cure their disease. In the light of this type of spirit, I was awarded a few months ago with the Umberto Veronesi Award. I was very surprised about this because I asked why should I receive this prize. But they told me because you did something that in the landscape of Europe was not so common, because you believed that immunotherapy in breast cancer may be a reality. When I started working in immunotherapy in breast cancer, it was 15 years ago, when immunotherapy was not finally the best access to care for any type of patient. But I remember very well that Umberto Veronesi told me, I am quite sure that many breast cancer may be related to a virus infection, so why don't you start working on vaccine? The only thing that we had in that period was vaccine. There was no immunocheckpoint inhibitors. And we started the first trial with vaccination in patients in the adjuvant setting, using specifically vaccine at tier 2. Don't forget that in 2000 there was no trastuzumab available, and we were the first to use a tier 2 vaccine, so a peptide against CRB2, in patients in the early breast cancer setting, vaccinating these patients in order to prevent relapse. So my final message is that the environment of the European Institute of Oncology was an environment of innovative medicine. When we started this institution, we were the first one to do the quadrantectomy, we were the first one to do sentinel node biopsy, the first one to use nuclear medicine for diagnostic and therapy. And then we established the first phase 1 unit, because the first phase 1 unit was built in the European Institute of Oncology in 2001, when no one was working on early drug development. I believe we had the legacy of Umberto Veronesi, that was a very bright man with a lot of innovation, And what we would like to be for the future is to be the best comprehensive cancer center for sure in Italy and one of the best 5 comprehensive cancer centers in Europe.